Hello, my name is Jocelyn Stewart. I'm a registered nurse, and I'm currently enrolled in the University of Arkansas at Little Rock in the Bachelor's of Nursing and Science program. I am here to perform a head-to-toe assessment. I have previously washed my hands before encountering the patient. Is not to introduce any foreign bacteria or infections to the patient. I've also obtained vital signs from the patient which were in normal limits, which were reviewed and discussed with the patient prior to. I'm Jocelyn. Okay. Do I have permission to perform this video?
Yes, ma'am.
Okay. And can you tell me your name and date of birth?
Zania Stewart, 6/28/95.
Okay. Can you tell me the month and the year?
August 2016.
Okay. Can you tell me the city?
Sherwood, Arkansas.
And can you tell me why we're here?
For an examination.
Okay. The patient is alert, awake, and oriented ×4. She is aware of the procedure that is about to take place. She's dressed appropriately and she has a normal affect. Okay, so I will start the video by assessing the head. Her head is normal shape and size. There's no micromegaly noted. The scalp is normal cephalic. She has no lesions, no sores or patches to the scalp. Her hair is dry, it's coarse, and the color is evenly distributed throughout. I will now assess the face. Her skin, you can see, is uniform. There's no discolorations or blotches to the face. Her eyes are symmetrical within the upper third portion of the face. The nose is midline, and her lips are symmetrical within the lower third portion of her face. I will now assess her eyes. Okay. Okay, her pupils are equal, round, and reactive to light and accommodation. Conjunctivi are pink and moist, intact. There's no redness or swelling to the orbits of the eye. No edema noted. No tenderness noted to the frontal and the maxillary sinuses. Okay. We will now assess the ears. There is no tenderness to the tragus or the penta or the maxilloid process. Okay, her ears are elastic. They recoil immediately. There is minimum circum to the ears. And if I had an otoscope, I would look into the ears and assess the tympanic membranes of the ear. Make sure that they are pearly and gray with no lesions, no scarring, and assess the bones. And if I had an ophthalmoscope for the eyes, I would have the light to the eye and look for the red reflex, and then I would look into the back of the eye and look for the optic nerve and the optic disc and assess the vessels of the eye to make sure that they're intact. There's no shrinkage to the vessels or enlargement, and that the colors are proper yellow-orange color to the optic disc. Okay. I will now move to the carotid. And I will assess the carotid arteries with palpation. and they are regular rate and rhythm, bilaterally and equal, +2 amplified on a scale of 0 to 4. I will now auscultate the carotid arteries with the bell of the stethoscope, and I will ask the patient to take a deep breath and hold it. Very good. Take a deep breath and hold it. Very good. The carotid arteries are strong, equal bilaterally, with no bruits noted, no abnormalities. I will look into the mouth, within the cheeks. The color is pink, it's continuous. The hard palate is transverse row with no lesions. There's no lesions within the cheeks. No sores noted. The uvula is midline. You say ah. It moves up and down. The tonsils are intact with no redness, no exudate, no swelling noted. The tongue is rough. It has no lesions, no white patches noted. You lift your tongue. Okay. The soft palate is pink. There's saliva noted. There's no lesions, no scars. In the ventral portion of the tongue is glossy and it's glistening with veins noted. Her teeth are intact. There's no gingivitis noted to teeth, to gums. No swelling to gums noted. Okay. Next, I will move on to the lungs. If you could turn that way. The spine is midline. There's no deviations or S curve to the spine. I will touch the skin. It's warm and dry. There's no lumps noted, no bumps, no abnormalities to the skin. I will now test. When I touch your back, say 99.
99, 99, 99, 99, 99.
Okay. And now I will cuss. There's normal tempus with percussion. There's no dullness in this area. Sounds are normal. I will now auscultate. Lung sounds are equal bilaterally with no wheezing, no adventitious sounds noted. Okay. I will now auscultate the anterior portion of the lungs. Her sternum is midline. Her clavicle is intact. I will test the tartar. The skin is elastic and it recoils immediately. There are visceral lung sounds noted in this portion of the lung. Okay, take a deep breath. Take a deep breath. And take a deep breath. lung sounds anteriorly or equally bilaterally. There's no rubs, crackles, wheezing noted in lungs. I will now move to the heart sound. Her chest is even. There's no visible palpitations noted over the pericardium area. I will assess the aortic lung sounds, which are located in the left sternal base of the second intercostal, using the diaphragm of the stethoscope. I will auscultate the pulmonic, located in the second intercostal of the left sternal base. I will auscultate Erb's point in the third intercostal of the left sternal base. I will auscultate the tricuspid, located in the fifth intercostal of the left sternal base. And I will auscultate the mitral, located in the fifth intercostal of the mid-clavicular line. All heart sounds are even, no bounding noted, regular rate and rhythm, no murmurs or extra sounds noted. I will now auscultate using the bell of the stethoscope in the aortic and the pulmonic area where S2 is prominent. And I will auscultate in the tricuspid, in the mitral area where S1 is prominent. And I will auscultate Erb's point where S1 and S2. Okay. I will now assess the abdomen. All the way back. Okay. I will palpate the abdomen and auscultate. The abdomen is round, is soft, non-distended and non-tender to touch. I will palpate the right upper quadrant for the gallbladder, the pancreas, the liver, the duodenum, the transverse colon, the ascending colon, the kidneys, right kidneys and right adrenals are located. The left upper quadrant, there is the pancreas, the stomach, the spleen, the left kidneys and adrenals, the transverse colon, and the descending colon. Okay. The left lower quadrant, left right quadrant, lower right quadrant. There's the appendix, the cecum, the right ovary and tubes, the right uterus, and in the left there is the sigmoid colon, the descending colon, the left uterus, and the left tubes and ovaries. I will auscultate the abdomen in all four quadrants and assess for presence and activity. right upper quadrant. Vowel sounds are present and active. Left upper quadrant. Vowel sounds are present and active. Lower right quadrant. Vowel sounds are present and active. The lower left quadrant. Vowel sounds are active, present. Okay. I will now assess the nails in the peripheral vascular system. Her nails are transverse. The cuticles are intact. The nail beds are pink with no cyanosis, no clubbing noted, with less than 160-degree angle noted on the nail beds. Her capillary refills to her nails are less than 3 seconds. No clubbing, no cyanosis, less than 60 degrees bilateral. Skin to her extremities is warm and dry. Brachial pulses. Are even with regular rate and rhythm, amplified 2+ bilaterally. Radial pulses are equal, rate and rhythm, amplified +2 bilaterally. Skin to the lower extremities is warm, dry. Nail beds to toes are transverse, pink, no clubbing noted, no cyanosis to toes at less than 160 degrees bilaterally. Popliteal pulses are strong, equal bilaterally, +2 amplified. Tibial pulses are equal, strong, amplified +2 bilaterally. Dorsal pedal pulses strong, equal, bilaterally. There's no edema noted. To extremities, and that is the completion of my assessment.